It is 4 o'clock, and we will call the meeting to order. And welcome to all of you that are here. At this time, we'll have public comment. Any member of the public may address the City Council regarding an item on this agenda. Such comments must be relevant to the agenda item. This is not intended to be a question and answer session, and each speaker is limited to 4 minutes. Shelley, do we have anyone signed up?
No, ma'am.
All right. I don't believe I need to say anything more about that. Is there any member of the public that would like to comment on a posted workshop item that has not signed up? Okay, very good. We will move on to the information and discussion of this meeting, and I believe Chief Smith is going to bring us information on the thing that is the only thing in the news lately, the coronavirus.
Glad that you are. Oh my gosh. Does that always do that?
It adjusts.
It's my day to shine. I'm so glad to see you back. I will try not to make you laugh too hard if it hurts.
Don't tell any jokes up here.
Right. I'll try to keep my microphone.
But it's good to
This
be
is
back.
serious
I'm
business.
feeling great. The
Good.
first 2 weeks was rough, but I feel fine now. So
Well, I'm glad to
as long as you don't tell any jokes, I think I can.
Okay, I'll try.
It's okay. All right. So as Councilmember Eichner said, I think COVID-19, it's pretty much occupied the news. And you all aware of what it is and the impact it's having around the world. But what you may not be aware of is for over a month now, probably 2 months, our emergency management representatives and emergency medical services has been a part of a task force in the community. And we started out over a month ago, probably pretty close to 2 months now, having weekly conference calls. Those have now become daily conference calls. And basically, they've been with the Center of Disease Control, the Texas Department of State Health Services, STRAC, South Texas Regional Advisory Council, which coordinates all the medical aspect in the region that we're in. And we just wanted to make sure that we stayed abreast of the latest information that was available so that we could keep the city manager, you, the council, and the community informed. So today we want to take just a little time and talk to you about what we've done, what we're doing, in hopes that it doesn't escalate beyond what it's done now, but if it does, we'll have the city of Kerrville, our community, prepared. I've got a number of people here that's been a part of that task force for the past month. Some of them will share in the presentation today. We have our emergency management coordinator, Jeremy Hughes. I think you know our deputy chief and emergency medical services coordinator, Eric Maloney. The county's emergency management coordinator, Doug Thomas. And then we also have with us Pam Burton, who's the infection prevention representative for Peterson. She's really coordinated every aspect of what we've done for the past month from the medical side with the physicians, and then with us, fire, police, EMS, that piece. She has her supervisor with her, Barbara Stalin, and I'm not sure of your role, but you want to tell us right quick?
Quality at Peterson.
And then who doesn't know the PIO? Okay. She seems to be everywhere. So what we want to do today is we want to talk to you about the facts and fears surrounding COVID-19. Discuss with you the signs and symptoms that you can be on the lookout for. We've got some good information, we think, in terms of sharing with you. You've probably seen it already on our website and through other PSAs we put out, but just how you can stop the spread of germs and possibly COVID-19, not only here in the council chambers, but at home, and work. And then you may not be aware of this, but several months ago, I think we did a presentation with the city council when most of you were new at that time, and we talked about the city's emergency operations plan, the 22 functional annexes that are in it. One of those annexes is Annex H, and it actually has a pandemic plan, a 6-phase pandemic plan that the city, should follow in the event that we're dealing with something just like we're dealing with today, COVID-19. And following that plan, we've worked through phase 1 and 2. On Friday, we implemented phase 3. So we'll tell you about what happened during those phases, and then at the very end of it, we'll open it up for some questions if you have some. Okay? So having said that, we're going to start out with Pam. You want to come up and just talk to us about the Fiscal Years?
Clicker right left. Hello, I'm Pam Burton, infection preventionist at Peterson Health, and I want to thank everyone behind me here for the support that they've given me. So we're going to go over a little bit of facts about the coronavirus and what we are seeing. So the coronavirus is a virus that is respiratory. It's a crown-like spiked virus. If you look at pictures, and if you've looked at the CDC site, they have a very pretty picture of this virus. This group of respiratory viruses can cause illness anywhere from the common cold to pneumonia, and symptoms can range anywhere from mild to moderate. We do have more severe cases. We're all familiar with the severe acute respiratory syndrome, or SARS, that came out. We also had the Middle East respiratory syndrome, or MERS, that we also had in the past too. So this is just one of those viruses we weren't aware of. It's new, the novel coronavirus. So we are learning more and more about it on a daily basis. So we're really working to keep the community, our healthcare providers, up to date in regards to this. It was named first the coronavirus 2019, and then they switched it to the COVID-19. Like I say, it's new, it's different from the others, and so we're still learning about it. On December the 31st, 2019, China reported the outbreak of a respiratory illness. They first identified this outbreak in a group of people with pneumonia and associated it with a live animal market in Wuhan, or the Hubei province. January the 9th, 2020, China's government first announced the novel coronavirus. Progress of the outbreak, cases started to be identified outside of Wuhan early in January, and then we simultaneously had it arise in other countries. At first it stayed in the mainland China, but as we all are aware, it has branched out to other places. Majority of these are related to travel history. So that is what we're finding, a common denominator. Early in the outbreak, it was related to direct exposure, travel history, but in China, they did start confirming person to person. We need to pay attention to China's geographical area and their cities. They're very close-knit, very populated, lots of public transportation, so you can see how easily the person-to-person transmission could occur in those types of situations. Data, global numbers, there are 111 million, thousands?
I think it's thousands.
I've been doing numbers all day long, I apologize,
I hope it's
363. Yes, need to take into account this is a total number of the coronaviruses. It does not bring into account those that have recovered, which is a very large number in itself as well. Our United States numbers, as of yesterday, we had 566 total cases. We've had 22 deaths, and Texas currently is reporting 12, but that did change this afternoon to 13. So we have Harris County, Fort Bend County, each of those have 3, and then we have one up around the Dallas area in Collin County, or Collier County. These are all related to a group that took a trip in Egypt on a boat. So we are able to relate those. The data that's reflected does not include those people that we've brought in from cruise ships or that we brought over earlier on to San Antonio and other locations. The bottom numbers, cases among persons returning to the U.S., those do. So we have 3 positive from Wuhan, and we have 45 positive from the Diamond Princess. Prevention, personal protective equipment. There is no vaccine at this time, contrary to what Facebook and media is saying. We do not have a vaccine for the COVID-19. What is the best way to prevent illness? Please try to avoid being exposed to the virus. Take precautions. Avoid close contact with people who are sick. Avoid touching your eyes, your nose, and your mouth. I call that your T zone. You can make a T to demonstrate that. Sneeze into your sleeves or your elbow. Cover your sneezes with a Kleenex, then dispose of the Kleenex and wash your hands. Throw it in the trash. Stay at home when you're sick. Please don't go out if you're sick. We have a lot of home delivery services with HEB, and use those if you can. They can deliver to your home and put them on your doorstep. Clean and disinfect frequently touched objects. We think of frequently touched objects as doorknobs, desktops, keyboards. Think of those outside of the box, steering wheels, handles on your car. A lot of us do the push carts, the grocery carts, those types of things. Think outside the box when it comes to cleaning the environment. CDC's recommendations for the face mask. Everybody knows we've had a rush on face masks. Everybody needs a face mask to protect themselves. Please be careful. They do not recommend people who are well to wear a face mask. Why is this? You don't have anything to spread. And it's not really going to prevent you from getting anything per se. Yes, healthcare workers do wear face masks. That is the population that do need it. Our emergency response teams need those face masks, need those N95s for two reasons. One, we want to protect those that we're providing services to. And two, we want to protect us in regards to OSHA standards for blood and body fluid exposure. Face masks should be used by people who show symptoms. So we pass them out to our patients that are our visitors that come that are exhibiting colds or something like that. We don't want them spreading that virus among our already compromised population. Wash your hands often with soap and water for at least 20 seconds. You don't have soap and water, use your hand sanitizers. They work just as well. Remember though to use soap and water sometimes throughout the day if you're using the sanitizers. This builds up on your hands. It can also take your skin integrity and compromise it. It can dry it out. So remove that buildup sometime during the day, but it still just as adequately can be used for hand hygiene. We are using these guidelines when for assessment when we are looking at patients. These are recommended from CDC. It's also part of the San Antonio Metropolitan Health District and our Region 8 Texas Department of State Health. We have our clinical features. These are what we're looking at. If you will take a close look at what we've been talking about as far as signs and symptoms and clinical features, these represent what we see with our flu or with our other respiratory viruses. So we need to keep that in mind. So how do we take that further? How do we distinguish that COVID-19 patient? We look at the travel history. Presently, we have China, Iran, Italy, Japan, and South Korea on that list. Will this change? Potentially, yes, it will change. We are updated on a daily basis, as I already mentioned, with daily, weekly phone calls. And I'm going to turn it over to medical response.
Good afternoon. I'll talk a little bit about our medical response and what we're planning to do here. Obviously, we've had an opportunity to do this in the past with the H1N1, with the Ebola. So we built this out with some of the pre-screening out there. One of the things we're doing is, first thing you do is do identification early. So if you have a high index of suspicion, that is the key out there more than the PPE, the personal protective equipment. So we're doing that with Kerrville Police Department. They're doing the pre-arrival screening. So they've had instructions for probably 2 months since they came out of questions that they're asking our patients when they call 911 or call in for an ambulance, so that if they're having signs and symptoms, very similar to the one before, they're all also asking some other questions. That allows them to notify first responders that are arriving there, whether it be police or whether it be EMS or our other first responders out there. And our EMS will also, or first responders also ask those same questions. So if we can do more levels, those individuals high level of suspicion, then hopefully we can catch it in the field before we come into the hospital at that point. EMS response is a little different. So when we get there, so similar to what we've done in the past with the other outbreaks there. With an EMS response, there's a couple different options. The first one is we're working with MedCom out of San Antonio, the South Texas Regional Advisory Council. Their Regional Medical Operations Center, or RMOC, is up and operational, and they're also working with DSHS Region 8 to provide guidance for EMS on what is the best option for that patient. Couple different options there. One, if you have mild symptoms, which is 80% of the population, you may be staying home at that point, and DSHS will follow up with you 2 times a day, checking for fever, checking for other signs at that point. So if you have moderate, so you may be transported to a San Antonio hospital at that point, or maybe even to Peterson. Then, of course, there is the more severe or the critical individuals that would be transported locally to the closest appropriate facility. So one thing to stress, and we've been working with Peterson directly, is that no patients will be transported until we're all on the same page. And I think that's important for the safety of our first responders, safety of our patients, and safety of our other patients at the hospital or any other receiving facilities. So we're coordinating with them. We do have an algorithm built out with Peterson. It's actually built on the one we did with Ebola and made a few modifications with that. And so that if we do transport a patient to Peterson, that we're all on the same page of what we're doing and where the patient is going actually in the hospital. And that is one of the things that we've been working on and making sure we shore up with that. Of course, there are only 13 cases in Texas, so there is a lot of unknown factors with that as things change and progress. But we're on a weekly phone call for our region with our RMOC and giving us updates for healthcare providers out there. So we're getting the guidance as a regional response also.
Good afternoon.
Good afternoon.
My part, I'd like to share with y'all what we're doing on the emergency management aspect. We are currently working out of Annex H, which is our health and medical annex. If you're not familiar with the annexes, we have, it's like 26 annexes, and then our basic emergency plan. It's basically guideline from the state all the way down to the local government. It's basically plans that you follow to help you whenever there's a crisis. So that way you're not reinventing the wheel or shooting from the hip. There's a solid roadmap in front of you that you can follow to get your community through the emergency. The difference with a health problem is, we've been able to watch this from a long distance whenever it was overseas in China, and then we've tracked it coming back. So we're really ahead of this pandemic that it is now. We've been working together. So in the Annex H, it has the city of Kerrville's pandemic plan. We have been following that from the beginning. It outlines a 6-phase approach. And then we initiated phase 1 and 2 on January 24th. And then Friday, we moved into phase 3. The next slide, I'll kind of briefly go over the different phases. And then again, if you go back to, what I mentioned, the annexes are kind of a roadmap. If you find stuff that needs to be changed on the fly, you can do that, and you'll see where we did it here. We are currently in phase 3. We're still green. We haven't moved into yellow yet. And basically, if you look, if you have it infected in Texas, then that would take you all the way to 6. Well, what we've identified is, remember, everyone in Texas, they've tracked them. It's been from traveling. It's not a community spread. So they've all been quarantined. So that's why we're going to adapt the plan. It's due to be updated next year. So we're getting a lot of good data to put in that annex for next year, which will serve us in the future if we ever have to use it again. So phase 1 and 2, what we did was we created the Annex H subcommittee that consisted of the city of Kerrville, Kerr County, and then Peterson Regional Medical Center. What we decided in our subcommittee is what's important is to have that one message for our community. We don't want to all be saying different things, even if it's close. We want to make sure that it's that one message, so that way people don't get confused. We can keep our citizens safe. We decided, Peterson is the health leader in our community, so it was important that they had the lead on the messaging, and then the city and county would back them up on getting that message out. And I'll share with y'all what I've shared with every employee. When Stuart puts out something on Facebook, share it. The information that's good for the citizens of Kerrville, the information that's good for the citizens of Kerr County is good for the citizens in California. It's good for the citizens in New York City. It is the message coming from the CDC. My kids taught me about hashtagging. I'm hashtagging everything, facts, not fear. And the reason is because that's what we want. We want people to know the facts, but we don't want to scare them either, So that's how we've been delivering it. So if they're educated, they won't panic. We want them to know that we're there for them and we're working on this and to keep their health. So in phase 1 and 2, aside from establishing the committee, the message was education. So that's what we started doing. We started passing to the public through press releases one message. We had our first meeting. We set it up before the United States had their first case. By the time we had the meeting, though, at that time we had our first cases that were brought here from China. They were evacuees. From there, we decided that our next trigger point would be kind of as needed, but if it came to Texas. So the next one was the one that was being quarantined in San Antonio, and they became infected. So we went ahead and triggered our next meeting. Then from there, we decided that we would meet once a month. We met yesterday. We've now upped that to we'll be meeting on once a week on a regular basis, just to make sure that we're prepared, keep getting it out. Whenever it comes to emergency management, every day that this virus is not in Kerrville, every day that this virus is not in Kerr County, every day that this virus is not in one of the surrounding counties, that gives us one more day to prepare and make sure that our citizens are protected. So that's kind of the thought, and we want to continue to be up on this. Our next step that we are doing with our committee, next week we will start meeting with our stakeholders. I started contacting a few of those today. We want to make sure that we get that word out to them. As the city of Kerrville, we can follow our plan, and we may come out where we have a fully functional city, but if K-Pub's not functioning, if Peterson's not functioning, if the county is not functioning, then we really failed. So we want to make sure that everyone knows what our plan is, and if they follow along, they can make sure that services, everything is still functioning out there. So that's kind of the idea and the approach that we want to take as we move forward from here. So phase 3 that we implemented Friday, we had all the department heads. We met in here and kind of discussed the same thing that we're discussing with y'all. Number 1, each department, thank you, Chief. So each department, they're developing alternative staffing plans if 50% of the staff was absent in essential service areas. So you figure if you take what we know of this virus, the 14-day incubation period, roughly 2 weeks to heal, which is 14 days. If half of our staff went out with it in 14 days, when they're returning to work, the other half's going out. Now, if you look at the flu, it's usually not half of our staff that goes out, but it does take a chunk out of our staffing anytime that the flu season rolls around. So that's the idea. If we're prepared for 50%, then anything shy of that, I mean, we've got it. we've got a good plan in place. So each department is planning for that. The next thing is for them to identify critical functions that will continue and non-critical functions that could be temporarily suspended in the event of a pandemic and, of course, influenza respiratory outbreak. So in the event that the coronavirus gets to Kerrville and people start getting sick. We want to see what we can just put on hold for now, and then you have those things, law enforcement, fire department, if those functions have to continue. So we have to have plans like that, and that's throughout the city. We're in budget time. We have to have a budget next year. So every department has a critical function that has to continue, and the idea is if you're doing it with less, which ones do we focus on? So that's what they're planning for. And then the last is to identify, review personnel, contractors, suppliers, shippers, resources, and other businesses that support critical functions, and as necessary, identify backup resources. A good example of this is personal protective equipment pertaining to medical. 2 weeks ago or maybe a month ago, if you would have bumped into the shelf, hand sanitizer would have fell on the floor. It was everywhere and full. No one bought it. Now you can't find it. So it's identifying where can you get that hand sanitizer, who can provide it for you. For us, it's the N95 masks that healthcare workers need and have to have. As this progresses, finding out alternatives. Is there something different we can do? So that's what we need through with everything. Whatever the supply is, we got to find those alternative resources because those other companies could be affected the same way that we're affected. They're going to be at half staff. They're going to have trouble producing their products. The N95s, some of them came out of Wuhan, China, and Wuhan, China is the one that's ground zero being affected by this. So it's thinking through that and coming up with that plan. All right, and then the last parts are more on the back side. Basically, we want to participate in community emergency exercises and implement corrective actions. So, basically that's what this is. This is me giving y'all the information. We're participating in this. We want to continue that. If we identify something that we need to train on before that virus gets here, or it might already be here, we want to make sure that we shore those up every time we identify something like that. I already talked to Charvy. We're going to still run through the EOC and just make sure everything was working. We had a scheduled exercise that we had to cancel that was planned for this Friday, but me and Charvy's still going to get together and just make sure that the phones, the TVs, everything is ready to go if we have to activate the EOC. So we're going to continue to do this training and make sure that we're ready. And then we ask that everyone would be complete with these tasks by March 25th during the leadership team meeting. So at this time, each department will share and let us know what they came up with. And the key is that collaboration. It's like the library could have the thing that Chief Smith's missing for the fire department that we just didn't see. And it's like, that's a good idea. If we did that for our staff, we could function better. And then vice versa. Finance could have something for the police department. The police department could have something for human resources. So it's that working together, which we've been doing. We've got it. So we'll continue that. The last thing that I have is it might sound like a broken record, but we can't enforce this enough. Avoid contact with people who are sick. Avoid touching your eyes, nose, and mouth. Cover your cough when you are, cover your mouth whenever you cough or sneeze. with the tissue. Then make sure you get that tissue into the garbage. Stay at home when you're sick. Don't go to events if you're feeling bad. Don't come to work if you're sick. You want to avoid getting other people sick. And then clean and disinfect frequently touched objects and surfaces using a regular household cleaner, spray, or wipe. Lysol, if you always use Lysol, that's good. Just remember, disinfected surfaces are only as good until the first person touches it. So that's kind of like a contingency plan for all of us. In the city, we're going to go through disinfecting all the areas and clean on a regular basis, especially for our citizens where they frequently visit, library and et cetera. But remember, just because it was cleaned doesn't mean it's still clean. As soon as someone touches it, they could spread something. So before we go into the questions, that cut off. Before we go to the question section, I'll turn it over to Chief Smith in case he has anything to add. Thank y'all.
Thank you.
Thank you.
Just a few closing comments for the council before we take questions. Chief Hughes mentioned stakeholder meetings. We're going to be holding those on March the 17th, the 24th, and the 26th. And in those meetings, we intend to invite, all of our key stakeholders in the community, KISD, KPUB, UGRA, Shriner, and then in addition to that, we're working on a mail out to actually get out to the business community, just informing them of what we're doing and the protective actions that they can take to protect themselves and their workforce. You should have what Eric has given you, a document we created this morning, a situation report. We created this last week, and it's something that we intend to update on a weekly basis. Come in on a Monday morning, get it updated, and get it pushed out to the entire set team and leadership team. And if you look at it, the top of the document kind of has a description of what the event is. Just below that, the color-coded section describes the current situation, what's happening in the world. Then you have the U.S. and what's happening in Texas. I think it's important to point out that there are 12 confirmed cases in Texas, but as it was stated by Peterson earlier, they're all related to travel. There's been no community transmissions that have taken place. And then below it, you can see the information regarding those individuals that will be coming into San Antonio from the cruise ship that was in San Francisco. Bottom of the color-coded, you've got the confirmed cases and the total deaths in the world, the U.S., and then Texas again. And then at the very bottom, what we want to do here is just make sure that on a weekly basis, we update the information that's happening in Kerrville and that we keep it pushed out to the workforce and the community. So with that, we will take any questions you might have.
I had a question. There had been a rumor earlier that the testing kits they were running short of those. So is that true, or, I actually had a respiratory issue about 3 weeks ago, and I went and got tested for everything, and it was just...
The testing kits for COVID-19? Pam, you want to answer that?
My favorite subject?
Yep.
Well, it's kind of important.
It is very important. Testing kits are available to certain.
Pam, can you come up?
It'll get recorded that way, and that way.
Thank you.
Testing kits are available, but we have very limited numbers, and the Texas State Department is keeping those
Okay.
and doing it that way. If you have a respiratory illness, you question that, you give your physician a call or you give the hospital a call. We can still run testing for the flu, which is recommended. We can also do a respiratory panel at the hospital, which looks for other common respiratory illnesses. We want to rule those out first. Typically, if those are ruled out, or if you have them, we have what's kind of going on. But Texas Department of State Health, we still follow CDC and their guidelines in regards to testing. We contact them. They are the ones that set and verify the criteria and then decide if we want to test, because it is still a 48-hour turnaround, potentially maybe a little bit longer. Testing goes to Texas State Department of Health, which then goes to either one of their labs, and those labs are located Dallas, Harris County, Tarrant County, Lubbock, Austin, and there's one other place. I can't remember that last one. So but they only have the availability to do 10 to 25 a day, if that much. So we're being very cautious in regards to testing still, not that it is not available. Did that
Okay,
answer
good,
your
yes.
question?
It's nice to know it is available, you know, sometimes that'll put more fear in people if we don't have any of those, and that was the rumor I'd heard, that we were really short, which concerned me with, you know, all the allergies and everything that you see present and all the people that you happen to be around. I just want to make sure people know, just call your doctor. You can get tested if you,
We
thank
can
you.
look at it, and we do have other means. Yes, ma'am.
Right, thank you.
Any other questions?
A couple. First, thank y'all for coming and presenting to us, and I'm very pleased with what you're doing to protect our community. My questions, specific to our community, I'm just wondering what the closest local transportation facility is, and if we're our first responders are the ones that come in and transfer anyone that would need to go out of the community.
The closest facility that if someone
Has
presented-
severe symptoms and,
Okay, here.
An individual, if they actually had severe symptoms that required the closest appropriate, that would be Peterson Regional.
okay,
Is
so
where
it's
we
here,
would be going.
okay.
Correct. And
Okay.
they have rooms available for that, what they call a negative pressure room. So there's one in the emergency department. So it basically doesn't allow cross-contamination into other rooms in the ED. They have one in the ICU and two on the floor. So they do have that availability.
Okay.
Correct.
Okay. When would we move back into phase 2, phase 1, phase out type of situation?
Well, it doesn't look like it's gonna be anytime soon, because the numbers are steadily increasing. So, if there was a reduction and we actually started going back in the numbers where there was a vaccine,
Okay.
Antibiotics and stuff available, then we may consider moving back into phase 2, but it would have to,
You would have
COVID-19 would have to be under control for
You
us
would
to
have
go
those
back to phase 1,
conversations
2.
to make that decision. So you talked about stakeholders, and I heard you mention a few, and I've gotten, I think, at least 2 emails from KISD just kind of talking about what precautions they're taking, which I think is great. What about local physicians? Do you have a network for having those same kind of communication and messaging with the local physicians and a protocol? I don't know how you would do that. I'm just curious.
I can answer that question. We did put on a joint town hall meeting last week. We had 3 separate offerings that included the community physicians. So they were educated on all of our responses, but also on how clinics can respond as well too. So it has been recommended that they either do phone triage and look at the symptoms once again of these patients, do in the vehicle triage, or once again, and looking at the symptoms of the patient. Recommendation was that if these patients have mild symptoms, they're not in any acute medical emergency where they would typically call 9114. These patients, you contact Texas Department of State Health Region 8, review this patient with them. Once again, they may be sent home for self-quarantine and monitoring by the Texas Department of State Health. If that patient is one of those that you would typically call 911 with, you would go ahead and call 911. And then those plans that they have activated, they would activate, and the communication process would start from there. Did that address?
Yes. I think that's it for me.
Gary, any others?
No, thank you very much for
Yes.
coming today.
Thank you, Chief.
Thank
This
you.
is
Thank you.
good information for us, and thank you all for being here, and giving us this good information, and we'll just all keep our fingers crossed that,
Wash your hands.
and wash our hands. That's right.
You know, one more thing, travel. You know, I've got a wedding in May and my daughter's getting married, but there's relatives traveling here that might not travel. What are your just general recommendations for, let's say, something in May or June?
Well, my personal recommendations is, we were talking about this, and in the fire department, we had a few members that was scheduled to attend FDIC next month, which is one of the largest fire conferences in the country, and we canceled that.
It was in April?
And I think, you know, from a national perspective, you know, they're not encouraging travel, especially for the elderly. So,
Right.
you know, don't want to see anybody miss out. Is it a wedding?
Well, it's for me, it'll be okay, but it's relatives coming from other states
Right.
that might not come now, and
You know, travel is not being encouraged.
right. Just want
And,
to hear it from you so I can say I heard
And
it
I
from
would
a
certainly
professional.
discourage you from getting on a cruise ship.
Oh, yes. Even at a greatly reduced rate.
Thank you, Chief.
Thank you very much.
All right, at this time, we will go to the second item on our workshop, and that is our preliminary budget for 2021. And Mr. McDaniel?
Yes, thank you. This is unusual. We have not done this before where we had such an early budget workshop. Usually we start these in June, and after the proposed budget's filed, or actually right before it is. And so we thought it'd be nice to go ahead and have at least a preliminary conversation about some of the bigger issues that we will be challenged with in putting together next year's budget. A lot of this is coming out of your workshop on the last budget, where you all tasked us to go forward and look for ways to address certain issues in the next year's budget, like streets and so forth. So this is really wide open in terms of just a free flow discussion with the council on a number of items, and so there'll actually be questions in the PowerPoint where we're asking you, you know, what do you think about this, that, or the other? So to start us out, we have Amy, and then it'd be kind of a tag team between Amy and myself and EA and Kim and perhaps some others. So Amy?
Hi, Amy.
Good afternoon.
Good afternoon.
Okay, so like Mr. McDaniel said, this is a real early workshop, so we're not making any decisions today, but we are interested in your input on a few items, and we want to make sure you know what some of the biggest issues we'll be tackling are. We're going to go over some revenues, then expenditures, talk about Kerrville 2050, and then a brief overview of the calendar is the agenda. On the revenue side, I wanted to start with just kind of an overview of our biggest revenue sources. I think y'all are pretty familiar with this at this point, but obviously property tax and sales tax on the general fund side are major drivers. And then on the water and fund side, we have water revenues and sewer revenues, which are shown here under the services category. On the property tax side, I wanted to give you a little bit of a legislative update to start with. So the legislature met last spring, and made some changes to property taxes, as I'm sure you've heard. So I hit a couple of highlights there. Senate Bill 2 was passed last, I guess, May, June, but it wasn't effective for the budget year that we're in right now, for the tax year 2020 budget year. Tax year 2019, budget year 2020, became effective on January 1st. So this 2021 budget is going to be our first impact. And the biggest thing that you've probably heard about is this 3.5% revenue cap. A couple of things to note with that. It's a revenue increase cap on the operations portion of the property tax rate. So our property tax rate is divided into two portions. There's a maintenance and operations part, and there's a debt part. And so the debt portion of the rate doesn't change, and basically cities have to be able to cover their debt. So there's not a cap on that. The 3.5% cap is on the maintenance and operations portion of the rate. And it is on existing property. So it's a complicated, like 17-page formula, where they exclude a bunch of things, include different things. But basically, new property is not part of the equation. So if you have a lot of new property and new development, and your property tax is gonna go up by more than 3.5% just because of new property, that doesn't count against you. It's
Okay.
looking at existing property, our existing homeowners paying.
Meaning improvements primarily, annexation.
Yes,
improvements.
and just property value increases, you know, is there significant just market value increase?
Or
And
existing.
also looking at
Taken
tax
into-
rate too.
That's taken into consideration as well,
Yes.
market rate increase.
Yes.
Okay.
So if your appraisal on your house, just, you know, if you don't do anything to your house, but your appraisal goes up, that's what one of the things that this 3.5% increase is aimed at. The other thing would be if you're actually increasing the tax rate, that could cause it as well. But yeah, existing property only. So new development does not count towards your 3.5%.
So I'm sorry, so you're saying market rate increases are counted and new development?
So, so the 3.5% is on existing homes, existing property, and then actually the tax rate itself would be part of that too. So, we want to make sure that the legislature wants to make sure that cities aren't increasing burdens to taxpayers because either their appraised value has gone up significantly or because the city is saying we're going to increase the tax rate. So those two things would drive that 3.5% cap to be triggered. Does that make sense?
Yes.
But if there's a new Vintage Heights development and that adds 4% to the property rolls, that doesn't count against us because that's new development.
Not for the first year.
Right,
Yeah, and then
right. If the,
once it gets on the tax
correct,
rolls, right?
correct. Yes. Does that make sense? It's pretty complicated, so, so please ask questions.
Do y'all calculate, that's calculate state level, or do y'all have to
No, it's
manage
calculated
that?
at the local level, so, it's actually, so Kerr County collects property taxes for us. Kerr CAD provides the property tax, appraisal information to Kerr County, and then Kerr County has the software that we provide inputs to on, you know, what our debt requirements are and, different things like that, but they do the calculation as part of our contracted services with them. And then we have to go through it with them and agree to it, but it's a software-driven calculation based on the inputs from the appraisal district.
I'm assuming we don't know that until appraisals come out, the values come out, and then the tax rate gets set, and so
Yeah, and it gets
it's gonna put
really,
a crunch into that June,
yes.
July timeframe.
it gets very tricky with the calendar.
So then you're saying that if we, I know it's not likely, but if we did hit that threshold, then we would either be going to election or we would be reducing to.
We'd have to
Yes.
cap it.
Mhm.
Yeah.
And that's
Yeah,
that August 1st guideline, is that right?
So, the certified roll from the appraisal district is the first piece of the puzzle here, the first piece of the calculation, and that comes
July.
out on July 25th. And that's a Saturday this year, so actually July 24th, so hopefully we'll get it a day early. So that's the first piece of it, is getting that certified roll from the appraisal district, then we can start doing our calculations. So it should be that last week of July that we know if we're hitting that 3.5% cap or
And there's
not.
really no way to know
you'll be
until that certified roll comes out.
Right.
You'll be making some assumptions
We do.
based on how much it fluctuates.
Yeah,
in
we do
general?
make assumptions, and I do request periodic reports from the appraisal district on, you know, just give us a snapshot of where you are now. And it may be that, okay, 50% is set, and then this amount's under protest, or this amount hadn't been entered. And so we get snapshots along the way. I can say from previous years that those can vary widely from one to the next, depending on how things go in and get finalized. But it is a very tight turnaround. And yeah, it gets even tighter because if we do want to go above that 3.5%, and it would trigger an election in November. And it would require us to have that property tax rate and our budget passed by mid-August, because we have a 71-day before the election provision in the calendar that pushes us into August. And so that's very, very difficult. And there's a bunch of other provisions that don't seem to quite be in sync with each other, like the proposed budget has to be filed 30 days before you can vote on the tax rate. So if we had to vote on the tax rate in mid-August, do the proposed budget in mid-July, but we'd have to do the proposed budget without a certified roll, it really doesn't make sense from a calendar perspective. So basically, it's gonna be very difficult to do anything more than that 3.5%.
So you say down here that in the last 6 years, that would have only happened in 2015.
Yes.
What
Yeah, and
would
that's a
you-
good point.
What was the reason, in other words, what one thing could you say maybe would have caused it in that particular time period?
I think it was just appraised value going up. And, we've kind of seen, which I'm sure y'all are aware of, a little bit of kind of a cycle with appraisals where maybe they'll be kind of flat for a couple of years, and then there's a bigger increase in
Which
one
we
year.
had.
And so that was what was going on that year.
So maybe we're down because this year was the peak of that cycle.
Yes,
maybe-
so we had a large increase this past year. So historically, larger increases are not usually followed by continuing large increases, but.
I'm not anticipating this, Amy, so I'm just trying to get a handle on it. I'm sorry, this is my last question.
Oh, sure, that's fine.
But for now, this slide. Okay.
Let's make
You made
that
me forget
note.
my question. Oh, so if it gets to a point where you're going to have to go to election, are you basically presenting two budgets?
No. As long as I'm here, I won't be proposing a budget greater than 3.5%. It just doesn't, it doesn't make sense.
To try and go
But
through
it's
all that?
basically impossible to do.
Exactly.
And we
Right.
don't need to go above 3.5%.
Right.
I
And
was just kind of taking.
Yeah, I mean, just from what
pushing
she
it
just,
out.
from
Yeah.
what I heard
Looking
she's saying,
for
is
it.
basically
We
an
don't need it,
impossibility.
yeah.
Right, and then the other thing too is, say you did want to go above 3.5%, and then we get to November and the voters
Yeah,
vote
that's
it
what I
down, and
was
we've already
wondering
sent
about.
out tax notices and have to start doing
Well, I
refunds,
don't think
and
we'll need it. I was just
big mess.
curious
Yeah.
about
That's
what
good
would
to
you
know.
do
I'm
in that
reacting to what she
situation? No,
said.
I agree.
The election failed.
I have
then
no,
what?
I have no
Right,
intention of
right.
telling our citizens that we're going to
And
do
the
that.
election probably would fail, so.
Right, and a couple of things to note with this. So in the previous law, we had something called a rollback rate, and it was 8%. And so we just couldn't go above an 8% increase. So that 8%'s been taken down to 3.5%. It's now called the voter approval rate. With the 8%, though, if a city went above the 8%, they'd have to petition for an election. But under the new law, it's just automatic.
Automatic.
Yeah, there's no petition, it's just automatic.
Duly noted.
All right, so there's a couple of exceptions. The first is something called the unused increment rate. And this isn't gonna help us this year because it'll start in this year. But say for fiscal year '21, we only go up 2%. Then that means we have 1.5% of unused increment. And they take a 3-year rolling average, and we can use that 1.5% in one of the next 2 years. So once again, a complicated process.
Bless your
I'm
heart.
glad you're doing this.
Terrible.
Right. And then there's another thing too that I thought was going to help us, but I don't think it really will. Cities less than 30,000 in population, which would be Kerrville, we have something called a de minimis rate. And that means that our increase could be more than 3.5%, but less than $500,000, and then it would still be okay. But we can do that without having to go to an election, but all that other stuff about having to have the budget done in July and passed in August, all that stuff still applies. So it kind of like takes that off the table as well. All right, and then one other thing to note that we talked about just a little bit is that that debt portion of the rate is separate. So nothing changed with the debt portion of the rate and the laws around that, just the maintenance and operations portion. But as Mr. McDaniel said, we're not planning on going above that 3.5%. Sales tax. There's also some complicated stuff on sales tax that we've recently gone over. But anyway, so far, strong performance in 2020. The growth in retail and housing are good signs for continued growth, but sales tax is a volatile revenue source, and a global economic downturn could significantly impact sales tax. So that's what we're watching most closely right now. Overall, though, those new internet sales tax rules we think will be a net benefit to Kerrville. It's more the global economy that's the unknown right now. Water and sewer rates, we don't have any changes planned for 21. As you know, we made a lot of changes in 2020. So we're gathering data regarding the impact of those new rates and the new structure. And so far, our model seems to be working well. I was just looking at how we finished February. We're like less than $4,000 off of our budget on water, so real close, and a little bit better than budget on sewer. So far it seems to be working very well, but we have also had a relatively normal rainfall year, so that's helping us considerably. But just to note, when we worked with outside consultants last year to develop this rate model, they did recommend small increases on a regular basis to, keep up with increasing costs. Moving to the expenditure side of things, this is another just kind of overview. So when you're looking at expenditures by fund, general fund is our largest expenditures, followed by the water fund. When you're looking at it by category, this is the general fund over here on the right-hand side. Personnel is our largest expense. So no real surprises there. Within different departments, public safety is where we spend the most money. Over 50%, 51% of our budget this year is specifically for public safety. Streets and parks, also large drivers there. Now I'm going to turn it over to EA for a little bit of commentary on these next slides.
Good job, Delane.
All right, we're going to give Amy a break here for just a couple seconds and talk about streets and drainage. As you all know, it's been a big directive from council on being very aggressive on streets. We wrapped up the update to the pavement master plan, management plan in the fall time frame. You guys authorized some certificates of obligation for us to be more aggressive, going out there and doing a bigger program for reconstruction, but also a directive to really attack the maintenance program and really kind of ramp that up as we have been over the last couple years. As we identified within that 2019 pavement condition analysis, we've got about 28 million in current street treatment needs. Now that 28 million can't all occur in 1 year. Obviously, it's a periodic 10-year plan. But again, you guys asked us to be aggressive in really attacking that maintenance strategy to continue to either maintain that PCI or actually even increase that PCI slightly. And so we've got various funding options for that. And these are in no particular order. Street use fee, we've looked at, there are several cities across the state that have looked at that.
Explain how that works, EA.
Yeah, so the basics of it are that, you look at a it's very similar to what the county charges, in fact, on a road and bridge fee across the board on, basically every property owner would have kind of an incremental fee that would come in towards a sort of a dedicated street fund.
Is it based on anything or just a flat fee?
It can be set up in a number of ways. It could be by property size. It could be based off of different intensities of uses. There's a number of different ways that you can set up, or it could just be flat fee, similar to what you have on your when you get your registration every year.
Where's that billed at?
Your property tax bill?
It could be a number of different ways. Yeah, it could be annually through property tax bill. It could be on a monthly charge. It could be added to water and sewer bill. There's a number of different ways to collect on that. So, We're looking at, if it's the desire of the council, we could bring a work session topic to you on that at a later date if that's something that you guys express some interest in. A couple other ones, non-exclusive commercial solid waste franchise fee. A lot of communities have commercial solid waste franchise fees, pretty typical actually, and that is because of the intensity of the use of those haulers. As we've mentioned before, they're out there, it's a heavy load causing street damage, and so it's not atypical to see that coming through as a fee to then help repair those roads that they are damaging.
And it's
Sir-
paid currently on residential.
Sorry, say again?
It's paid currently on residential, but not commercial.
That's right. Service reductions in other departments, just prioritizing towards streets and having to pull back on other areas. Certainly an increase in property tax if you're wanting us to ramp up, but also keep those other service areas intact. Again, as Amy mentioned before, that is limited by that 3.5 cap. General obligation debt, which is voter approved and property tax supported, and then certificate of obligation debt, as you know, which is also property tax supported.
Why don't we have the commercial in place if we have the residential in place?
Because we have a single franchisee for residential, Republic, and
Okay.
we don't have franchises in place at all for the commercial
Right.
haulers.
Okay.
And so some cities will either do exclusive or non-exclusive, and what we wouldn't want to do an exclusive. Whoever's here now can stay here, but it would be that they would be subject to this
Okay.
new franchise fee because they're putting as much wear and tear on the roads as our residential trucks.
Okay. I got it.
Other questions on streets, comments?
Yes. So I'm assuming you're asking us questions, or if we have questions about this.
For feedback, yes, sir.
Yeah, and not looking for answers today, but if we're gonna go forward with this process, then I need to know, right now we're at 1.8 million on our street budget.
Roughly 175.
Okay, and it needs to be somewhere around 2.3, maintain our 70.
Right, so yeah, on the average, we looked at about a $200,000 increase over the next 10 years, basically.
Okay. And I guess that's what I would need back from staff then, is if we're looking at these as options, what does that look like to the consumer? I mean, if we're gonna consider a street use fee, which I'm not in favor of, I'm just saying, if we're gonna look at that, what does that look like to generate that type of funds? Or do we divvy it up between that and the franchise fee? And, I'd love to see some service reductions. I hate to call them service reductions, I'd call them cost savings. I hate to think that's gonna cut services, but,
You know how the water fund had the exact difference it would be? You know how we had that broken down into this new rate will be $3 more a month. That would help to know what are we
Right.
talking about this much?
So that would be the next step.
yeah, and I understand that. But I don't wanna throw anything out without considering it, but without additional information, it's really tough. And again, I would rather, item 3, I would say cost reductions as opposed to service reductions, so.
Yeah.
And just to give you a little bit of information addressing your question, but probably not as specific or in-depth as you're asking for, but a street use fee, if we did something like $2 per water account, that would generate about $240,000.
That's per month.
Yes, $2 per month, yes. And then on the property tax side, there's obviously lots of limitations there, but a 1 cent increase on our property tax rate, like from 54 cents to 55 cents, would generate about $160,000.
Okay, and I know we'll
That
talk about
kind of
more as we go
ballpark.
through the budget session, but that's,
Yep.
Yeah, if you're asking for, priorities of what we might, for me, I would want to definitely start with the ideas on the top 3. As we talked about, increasing our 3.5, increasing our property tax rate, we don't want to do, or I don't want to do, issuing more debt, I'd prefer not to do that as well. That's me. So if you're asking for feedback, to see some sort of evaluation of what that looks like, for me, if you want to spend the time, for me, that would be where I would start. Does that make sense? To get those.
I think yes, I would just like Gary, some additional information and something like what you're giving us there.
Exactly.
Give us an idea of what it would look like.
Some projections.
I mean, I wouldn't mind exploring all of them, but I do like it broken down into that 1 cent equates to 160,000. That really helps because that's a lot for 1 cent to get. And since we did reduce the rate last year, if we did nothing but keep it the same, whatever. I wouldn't mind exploring all 6 of them just for the sake of one's better than the other. Then we'll know more. So.
I think while we're on streets, and I know it's the city council's obligation and what our calling is to address these issues, but I think it's important for our citizens to continue to let us know, are streets still a high enough priority? Do you still want us to continue working on those? That's what we heard last year, streets, fix the streets. We've got to have the streets and drainage fixed. We've taken some steps that way, but I think it's critical. It's not my decision to make. It's the citizens' decision that they've got to give us the input. And so that's what I would call, I wish people would email me or write me or call me and say, we still think it's important. And we're willing to, if we have to pay, a street use fee, which I'm not in favor of, but if that's what it takes, then I need to hear that from the citizens.
Hill Country Drive, by the way, did not close during this recent rain. I'm just saying, it was I noticed it and I was like, wow, we're actually driving on this road that's normally closed. So we shan't forget these things, these little bits of progress.
We're glad that one.
To the tune of $1 million, $3 million, $7 million. What was the million for the Hill Country Drive by itself?
Well, the overall plan and the drainage all the way down to the river was around 3 million.
Right.
The piece that we were able to implement very effectively was about 180,000.
Okay. Thank you.
Does that help you, EA? Are you good there?
I believe we've got the feedback we need from you on streets.
Okay.
So let's move on to drainage. As you know, another element that this council has been very aggressive in really identifying, and the city doing the first stormwater drainage master plan that's ever been conducted for Kerrville. And within that, as you recall, there were 13 problematic areas that were identified across the community with a strategy to mitigate those items of around 22 million in identified needs. Again, some possible funding elements in no particular order. Drainage fee, we have talked with the council previously and were directed, I think actually in last budget season, because you guys budgeted for this year, to go ahead and begin to do that evaluation work so we could bring it forward to you for evaluation during this budget year. And again, some of those elements typically vary between commercial and residential. The commercial is tiered, usually based off physical size or intensity of use, and then residential can also be either flat or tiered, typically mostly just based off of size. This is based off of impervious cover and translates to essentially the amount of stormwater that you are occurring, or you are creating, that then flows off your property. And it's a combination of using GIS and KCAD data, and we're right in the throngs of completing that analysis. And we'll hopefully have that here in the next couple months to bring forward to you all for further evaluation. And then, of course, as we mentioned before, just like the streets, increasing the property tax rate, again, that's limited, and then general obligation debt and certificates of obligation debt.
Council, anything?
When's a drainage fee study? When do you think that'll be wrapped up for review?
We're hoping to have at least a draft back in the next 6 weeks. Like I said, we're in the process of kind of reviewing some early cuts of the data with them and making sure that everything is accurate, that they've pulled over from both GIS as well as KCAD. But we're hoping that by the time we kind of rehuddle with you guys at the next budget session, that we'll be able to have a better handle on what that data looks like.
Perfect.
And I would say again, probably any numbers that you can supply with for us then would be, give us an idea of what we're dealing with.
Absolutely.
Because as a taxpayer myself, I feel like if funds are needed, if you call it a street use fee or a drainage fee or a 1 cent increase in tax, one way or another, I will probably help pay for some of that. So I would like, to know more about all of them so I can decide which one would be more favorable for the taxpayers as well as myself, because we have to have the funding from somewhere. So if we're going to do it, and we've heard that people want the streets, and the drainage is the big part of the equation, so.
Some are tax deductible and some are not on your personal taxes,
Really?
So you can deduct.
your property taxes.
Okay.
Okay, that's the kind of information that will be good to know. Okay.
Okay, we're gonna move. Moving back to Amy. Yep,
Yeah.
there you go.
All right. Okay, so I have some good news on this.
And some
Okay.
some not so good news.
No, this one's
This
a
is
good
all
news
good.
slide.
Good.
Yes.
Good.
Debt service is the slide. So, interest rates going down significantly. And fortunately for the city of Kerrville, we have two different debt issuances, one from 2012 and one from 2013, that are eligible for refunding. You may remember some of these terms from the fall, and in December we just completed a refunding, but it's basically just kind of like refinancing your mortgage, but with city debt. But there's real specific parameters. It can only be done at certain times in the life of the debt. So these two debt issuances, we are in that window where we can refund them. And so we've been talking with our financial advisor from Hilltop Securities, and you'll see, this is a very preliminary calendar, but you'll see a calendar at your spots with some yellow and green on it. And this is our preliminary calendar for presenting information to y'all on debt refundings. So Ann Intrican is going to be here to talk to y'all on March 24th and tell you about our refunding opportunities. And then we anticipate bringing back to council on April 28th an ordinance for you to look at where you would authorize the refunding. And it would be similar to the one that we did in the fall, where it's a parameters ordinance, and you say that as long as the savings fall into these parameters, then we give our authorization to move forward with the refunding. But as of right now, we're looking at $13.5 million that could be refinanced and yielding a savings of $525,000 over the remaining life of that debt. So that's pretty big dollars. Most of the savings would occur in the budget years 23 through 26. So we'd actually see lower debt service in a lot of years, but the biggest chunks of it would be in those particular years.
Well, I'm sorry,
And-
which years?
23 through 26.
Okay, gotcha.
Yes. And then we're looking at potentially an interest rate on the refunding of less than 2%, like 1.9% would be the interest rate.
Is
So,
this because of the virus and the feds were, because of economy, they were
yes,
going to drop
yeah,
it?
it's very much driven by the economy. So yes, the Federal Reserve did lower interest rates, and then we've seen markets respond with lower interest rates across the board. And like in the mortgage interest rate sector, rates are down as well. And there's a real flight to quality right now. So municipal debt and AA rated debt, like the city of Kerrville has, is considered very safe. And in these, turbulent market times, people are willing to take a lower rate if they feel like their investment will be safe.
Less than 1%.
So our bond rating affects.
Yes, definitely. Yeah,
positive
the better
for
your
us.
bond rating, the lower the rate you can get. Also, we've been working with KPUB. We recently had a meeting with them. So we have a $7.5 million loan with KPUB. And and right now the interest rate on that loan is 2.4%. And we have been talking to them about renegotiating that rate down to 2%. So they are agreeable to that. I know that Mike Whitler has already talked to his board about it, and our city attorney is working on drawing up an amendment to that agreement to lower the interest rate a little bit there.
What savings is that?
It's not huge. I believe it's like 180,000 over the remaining life of the loan, but it's still something. And then something also that you'll hear about. So we have a loan right now through the Texas Water Development Board for the Legion Lift Station, and it looks like that project is going to be coming in with some remaining funding left. So there'll be some additional funding from the Water Development Board that we don't have to use for Legion Lift Station. And we can apply to the Water Development Board and just ask them, can we use it for another water project that meets their criteria? And we have several of those projects. So in the NAP area, which EA could give you a little bit more specifics on that, but we do have some projects in mind that that we're looking at going back to the Water Development Board. And so basically that loan's already been issued, that money is already ours to use. We just don't need it for Legion, so we just need to get their permission to say, can we use it for this other water project? So that's not adding any new debt or
So we're
anything
just
like
getting
that.
more for our money,
Is
basically.
there any expiration
What's
to
the interest
that?
rate on something like that?
The interest rate on that loan, we didn't get it, during this time. So I believe it's 2.25. One of them's 2.25 and one's 2.29. We have two loans with the Water Development Board. And they have some federal funding that subsidizes the interest rates. So at the time, that was like 135 basis points off of the market rate. But we don't have an opportunity to do a refunding on that
You know
one.
what?
We do not have an opportunity to do a refunding on the Water Development Board debt. It is, the rate that it is.
What it is.
But it's 2.25, so still.
If we went back to them for a
Well,
new
not bad.
loan, what would it be?
I'd have to look and see what their what their terms are right now. When we were getting those two loans for the Legion Lift project and the TTHM filtration system, depending on the type of program that you applied for and depending on how much federal subsidy they get, it was like 135 basis points or 1.35% off the market rate. So they would look at what, if your city issues AA bonds and the market rate for that is 4%, then you get 1.35 off of that is the way the formula worked. With rates as low as they are right now, I'm not sure.
I'm saying,
what-
it's basically free money
Right.
then.
Right, I'm not sure
Well,
if those
We might
terms
change
still
those
apply,
terms.
because that was a couple of years ago, so I'd have to
Yeah,
see what.
I'm sure it's a silly question, but I have to ask, would it be better just to give them their money back and reapply?
Yeah, they, what they tell us is they don't want their money back, so you have to go through a process to try to give them their money back. 'Cause
Probably
they
for this
have it,
very reason.
we've agreed to a repayment schedule. And so anyway, it would be a process to go through and see if we can give it back or if we're obligated to.
How much
it
are we
because it's
talking
already been
That's what I
issued.
was going to ask.
Yeah.
How
How
much
much
are
is
we
that?
looking at?
Any idea, ballpark?
3 million?
The remainder balance?
Yeah,
Mhm.
Around 3.2.
How much?
3.2.
3.2,
Million?
yes.
We missed the budget we came in 3.2 million under budget on the lift station?
It's a combination of two projects that came in with good bids.
It is,
Is there an expiration as to when you're talking about reusing the
30%.
difference with the Texas Water Board? Do you need to have a certain time period to request the reuse of that money?
The way their rules work, you have to have substantial completion on the project that you originally got the money on before they'll let you request it for the next project. So they want to make really sure there's not something else out there that needs to be paid or some big surprise at the end or something like that. So you basically have to get to the very end of your existing project before you can
And even request.
request for the next one. As far as how long you have, I don't know the answer off the top of my head, but certainly we wouldn't want to sit on that money because we'd be paying interest on it, so we'd want to use it as quickly as.
We just want to make sure we
could.
can, because like you said, you have to make sure you're within their
Yes.
requirements.
Yes,
their
but yeah, you do have to
criteria.
get to that substantial completion
Okay.
designation before you can even request
And
it.
surely we're
and
there,
so-
but we're there, right?
Rem-
We're not quite to substantial completion on Legion. Probably another month or so before we
Am I
get.
correct that that's being funded by EIC?
There was a portion of it funded by EIC and a portion of it funded by the Water Development Board.
So by the end of April, we should know. Okay.
And I'm assuming EIC doesn't have any say in this.
No. Not the way our agreement's crafted. Their money is the first in.
Yeah.
So we just, in another month, before we actually do our budget, we'll have a good idea of where we stand with this.
And do you want to talk to any of the NAP area projects that we're looking at, or?
I just want to clarify, so EIC is making the payments on a portion of this debt.
No, they actually did a cash funding.
So the first $2
Upfront,
million
right.
of the Legion project was
So they wrote us a
funded.
check for $2 million.
That's correct. The first $2 million of the Legion project was funded via EIC funds because of the impact that it had to businesses and the basically 100% additional capacity. And but for that capacity being implemented, we would not have been able to do any development or economic development in basically the entire southern corridor of the community. And so EIC felt like it was important enough to be able to make that contribution to the project. There was $8 million that was brought forth through the Texas Water Development Board loan, partially for the Legion Lift Station, which at the time was estimated about a $7.7 million project, as well as the TTHM project, which was about a $5.5 million project, I believe. Fortunately, both of those came in under budget, which at the time we were seeing rising construction costs on projects. And so we got lucky with great bids and great contractors. But when we went and did that original Texas Water Development Board funding, we did go for basically the entirety of those projects in combination with the EIC funds, because we were told at the time, you don't want to apply, have your project come in at a certain level and then have to go back in, because you have to go through the entirety of the process, the application process again, which is pretty lengthy.
You might also talk, though, about the NAP project and why that's important.
Yeah, so the NAP project is essentially an extension of, to some degree, the Legion project, because it is all one wastewater system. And that is part of what we're looking at are identified needs within that wastewater collection system that is then bringing wastewater flows down to Legion and ultimately to the wastewater treatment plant. So that we've identified that area really as the next area within the wastewater master plan. That's kind of the next hurdle to cross in being able to see where there's a pinch point for future development occurring along that corridor, kind of because we're going out towards the west. That is the next inflow hurdle that we're going to have. And so we were beginning to get our arms wrapped around some preliminary numbers of what it would take to alleviate that pinch point, so that way you could see really continued commercial growth along the 27 corridor out to the west, development around Nimitz Lake, and then further areas. Certainly we've seen a lot of activity around Yogi Bear, RV Park, and some of the more industrial areas along 27 and 27 North.
Okay, anything else?
Not at this time.
No,
Okay.
but a lot to think about. And it was good news, Amy. That's
right,
great news.
Next up, we have personnel, and Kim is gonna fill us in there.
Okay, so now we're going to talk about personnel compensation and benefits and as they relate to the budget. During the first 5 months of the fiscal year, we have 7 to 9% of our budgeted positions that are vacant. And it just depends on the day that we look at it is to determine what that percentage is. To help with recruiting, we're doing a compensation study right now The last time we did a formal compensation study was in 2013. And then we did an update to that study in 2015, and now we're going to do another update to it right now, and we hope to get all that data back by May.
Tell me a little bit about the compensation study. What does that entail?
Well, they look at our job descriptions are in good shape, but they look at all of our salaries and compare them to benchmark cities. And
Who
then
determines the benchmark cities?
we've determined them. We base them some on what we use for our rate studies and just similar populations and sizes of the cities, and with the same services, the police,
So
the
is
fire.
it the exact same cities that we've used for other benchmarks, or do you pick and choose?
We actually looked at a variety of them, and we kind of combined a set, and we have a good set that
So
we
that's a
think.
pick and choose? I mean,
Yeah.
I don't like that. If they're benchmark cities,
It is, well, we use some of the ones from the water study, the water rate study, and then we use some of the ones that we used for our previous compensation study, but some of those cities we're not
do you
comparable with
understand what I'm
anymore.
saying? Is that if you give me 20 benchmarks and I pick the 15 that I like, then you're not really giving me a benchmark.
We picked the number that we thought were better suited to, similar to
So
us.
you probably applied criteria that you used as your benchmarks for selecting, I would assume, the cities, such as population and
Yes.
maybe some other
So-
similarities.
It doesn't make sense to use the same benchmark cities for, say, water and sewer that you use for compensation. So the reason for that is that you may be a full-service city, and your other city that's you're comparing on population is a suburb, and they're getting their water from somewhere else. You know, so it's a lot of apples and oranges, and so in some cases it makes sense to have a different set of data. But there needs to be a rationale for that. It's not pick and choose because we like this one and we don't like that one.
Yeah, and that's my concern is from, I mean, and I'm not making accusations. I just want it to be really clear that we're getting good data. So,
And one thing also with choosing these benchmark cities is we don't have the results, so it's not like we got the results and then said, oh, okay,
This
we
is
want to
what we
pick
wanna
these.
use.
We're saying before we even get the results, these are the ones that we think are most applicable.
okay, and then, thank you. Then what else will be what will be shown in this study? What's going to be compared?
The salary,
Positions,
and the salary ranges and the pay grades.
And so
staffing levels.
it's strictly salaries, it's not benefits.
No, we're not doing benefits. So, but I will talk about benefits in just a moment.
Yeah, I've got some questions about that too.
Okay. So anyway, we did a formal in 2013, another update in 2015, and now to help with the recruiting, we're going to do another one. Some strategies that we're currently exploring to help with our retention and our recruiting is overhiring some of our anticipated vacancies, and then additional pay for bilingual skills, and then shift differential. So for the bilingual, Spanish is very handy in our court and in our police, fire, EMS, and utility billing. So it's, it may benefit us to hire people that have that skill and then pay them a pay for that. And then we're also looking at proposing in the budget a step increase, or the step increases for the public safety, the police and fire, and then also a COLA. And then we're exploring the opportunity of merit-based pay increases for general government versus COLA increases for general government. So as you know, merit, it's based on a performance evaluation score. That rewards employees for good work, and that aids in retention. And then COLA, of course, helps employees with inflation and living expenses. Everyone gets the same amount, a 2%, a 1%, a 3%, whatever that might be. It's easy to budget for.
So
Currently, we're on merit, is that correct?
we are, and I think the compensation study will help us to kind of know where we're at. And I'll tell you, the cities that we chose to look at were either in this region, even smaller ones, or similarly situated in terms of size, but not too close to an urbanized area, so that we felt like it was more apples to apples. So, for example, Fredericksburg, Bernie, Seguin, those cities, not something up in the Metroplex.
Sure.
So.
Okay. So now on the health benefits side, unfortunately, based upon our first 3 months of our fiscal year, our medical claims are up 36.3% as opposed to to 2018, from 2018 to 2019. We plan to go out to bid for FY 2021 benefits in May. And just upfront, a rate increase is likely. We are meeting at the end of the month to determine or to develop our strategy going forward. But we will go out to bid for all of our benefits in May.
Anything that backs up why the claims are
That's a
higher
big jump.
than in the past?
No, and it's not any high dollar claims. It's just a cumulative of small claims that are making that increase. You know, typically we get reports that are on claims that are more than 50,000 or more than 100,000, and we don't have that right now. So these are just a lot of smaller claims.
Couple of questions on benefits. As I was going through the budget book, just running some numbers, it appears that on average, based on the budget numbers, we run about 30% benefits to salaries. And it's interesting, it ranges from 21% to 39% by department. Why would it be closer than that?
That's because of the way we budget it, correct? We budget a flat amount, so we budget $6,500, $7,500 per employee per year, and then you might have a person fill a position where they're only an employee only, and then you might have the next time that position is open, you might have a employee with family coverage, and so we contribute more to that for that one.
Okay.
But this year. This year we're going to, Amy's got a different strategy and she's going to be, you want to talk about that?
Let me ask my other questions
Okay.
real quick too. When you come back to us with your your pay scale, I'd like some other information. My understanding is for employees, we pay 100% of that health insurance premium.
Yes,
And then what percentage are we currently paying to independent coverage?
60%.
Okay, I need to know if that's a common practice or not.
Okay, whenever we go out to bid, our benefit consultant will have that information and we'll be able to present that during the benefit part. But we will have that information for you.
So
What other cities are paying?
He'll come back and tell us what other cities are paying.
Our benefit consultant will know that.
Seemed like I asked that question last year and we never got a direct answer on that. So I'm really very curious about that. So
Okay.
I'd really like to have those numbers.
Yeah, we'll have that for
Whether
you.
that's a benchmark
Sure.
study. And again, I would like it, he can do that. I would like it based on who we use for our compensation scale, the same cities.
Okay.
I'd like to see what they're doing compared to what we're doing.
Okay. Okay, and the last thing that I'm going to talk about is retiree health benefits. When our population reaches 25,000, when the council determines that we are at 25,000, the city is required to offer health coverage to our retirees. We're not required to pay anything for the health coverage, so the retiree would have to pay 100% of that cost. And the potential impact to us, we won't know for a couple of years because of the claims that would come in, but it depends on how retirees are insured or how the rate is by the insurance providers. We could possibly, when we go out to bid, we can put this in our bid document that the carriers rate the retiree section separate from the employee section so that it wouldn't affect the employees if the claims are higher. And once we can also put in our policy that the city substitute Medicare supplement or Medicare Advantage once they reach that age. So then they would come off of ours after they reach age 65.
Kind of say that a little slower so I understand that on. So
On the Medicare part?
yeah, so if we reach 25,000, which I guess we're getting close to that, and I retire, and I retire at 62.
Yes.
So you're going to have to allow me to purchase group
Yes.
rate insurance.
Yes.
Okay. Now, if I'm over 65,
Then you would be eligible for Medicare.
for Medicare, but is there a supplement plan?
Yes,
then?
we could put in our plan or in our policy that it would be a Medicare supplement or a Medicare Advantage.
That's what
Once you qualify for that.
You said that, I just couldn't hear exactly what you said, so thank
Yeah.
you for clarifying.
So primary would be the administration of it then, is that correct? If we're not paying for the coverage itself, the administration of of the.
Right, and we are
policy.
fully insured. We're not self-insured, so the administration is basically just paying the bill and entering the employees into
Right,
the.
just the
into plan.
administrative.
Yes.
Right, okay.
Yes.
And the requirement is a state requirement. Is that?
State 25,000.
State law.
25,000.
State law.
State
Interesting, I
law.
didn't know that.
Thank you.
Oops, I didn't go. Oh, yeah.
And one other small thing on that
Thank
retiree
you, Kim.
benefits, it depends on how the insurers choose to rate. So if they say that the retirees have to be in the same pool with everyone else and that increases the rates overall, that could be a potential cost as in addition to the administration, so.
We go ahead and move to Gulf Fund. Just a quick update on there. As we've mentioned to you over the last couple months, revenues are up in fiscal year 20 compared to last year. Expenditures are down from where we have budgeted in the past. We continue to be very tight and continue to evaluate restructuring staffing over there as we've combined Gulf with, as far as an operation, with the Parks Department and trying to find efficiencies there and make sure that we've got efficient operations and cost reductions where we can. Again, we're excited to see a little bit of an uptick from where we had play in fiscal year 2019. Again, a lot of that's weather dependent, and we'll see how we go through in the springtime. We did have a mild winter, and we were fortunate there on that front, I think, in the Gulf Fund. So, and we've had good rain, so we're hoping for good turf going into the spring and summer season, and we're hoping that that will continue to expand in that way. We're also ramping up with the help of Parks repertoire, better marketing the course out there. We're hoping that that's also going to see an uptick in our playability out there. We continue to look at our regional competitors and what they're doing with their rate structure. We feel like we are very competitively structured on our rates, but we want to be very cognizant about the product that we're providing out there and that we are making sure that we are attaining the resources to maintain that. And with that, identifying capital needs. We do have capital needs that are out there. Where we are structured right now, we are really based off of revenues and subsidization from the general fund, really only able to maintain maintenance of the course in our general operations. And so we are not putting dollars into the capital needs, and those begin to accumulate over time. So because this is a separate fund, we really do need to look at that on an ongoing basis and make sure that that's built into our rate structure going forward. So we'll be looking at where folks maybe are changing rates as they're going, competitors as they're going into the summer, and certainly we'll be bringing that feedback to you all this summer to see if you all want to look at evaluating our rates as well.
Over the past 10 years, how many years would we have made money as opposed to how many that we have not?
Yeah, so it was about a break even, I believe, in the 2013, 2014 timeframe, when you really kind of saw a sort of a peak in the industry at that time, and then there's been really kind of a steady decline since
Well,
then.
and when Fredericksburg's course was under construction.
That's right.
We had a
okay,
good year
that's-
when
okay.
Fredericksburg.
Yeah, it was kind of a confluence of two elements, really sort of a peak in the industry, at least in the last near-term history, as well as, of course, one competitor going down, and so.
But I
a
think
great
you
year.
also don't look at this as a profit center.
Right.
It's
Yeah,
like,
I
you
was
know,
just about to
the tennis
say.
courts is a profit center, the swimming pool is a profit center.
How many
That was my other
tournaments do we
question
have
is,
here?
how are we
Yeah, like the
positioning
James
it?
Avery, for instance, which is the largest invitational tournament in Texas. If we didn't have Shriner, we wouldn't have that extra course. And then how many other tournaments do you guess? I mean, Ashley's not here to ask. I know I'm playing in a couple myself that are fundraisers. I guess it serves a purpose is what I'm saying. And again, like streets and everything else, if once something starts to need maintenance and not get it when it needs it, then it starts to snowball. And I would be concerned about somewhere down the road trying to catch up with the capital improvements because we do care about this course. I do anyway. I see a lot of people use it. I mean, my husband was over there this week playing with a group, and he can play other courses, but he chose to play that one for other reasons because we have tournaments we can't always get on our course. So we need that alternative. And I think it's a piece of history as well. So I'm just giving you my 2 cents, and I want to keep track of what we can do.
Is this common, or is there, I mean, is this,
Yes.
it's,
It is.
I mean, if you look at other cities, they're
Absolutely.
experiencing the same
Even
thing.
the country
I
clubs.
think Corpus Christi, when I was there, had 4 or 5 of them, and every one of them were subsidized. Fredericksburg, last time we checked, was subsidized at $500,000 a year. And then they contracted it out, and I think it went up. So we're actually doing pretty good, but we're not putting any capital improvements in, and we're really barely keeping up with the maintenance. So the only logical step is general fund or bond election or debt to do some of the capital needs. And so,
Well, we're already there with our capital needs.
Yeah, there's some
Yeah.
things that increase playability. The restrooms are very dated. We've heard complaints from customers about the restroom elements out there. There's some bunker elements that are gonna need some near-term improvements. And greens have a lifespan.
Sure.
And the reality is they're kind of like a sponge, and they build a little bit of a layer every year. And so it's not an indefinite like you would think of like your home, turf in your front yard. Those eventually greens do have to be just completely pulled out and replaced. We're not there yet.
It's like resurfacing a tennis court.
That's right.
That
Well,
lifespan.
And
That's
EIC
exactly it.
contributed some money to the tennis center improvement, so
They did.
is that an
yeah,
option?
it is.
It is.
It is.
And do you ever see any public-private sponsorships since this is pulled out of the general? Is that anything that's ever considered?
It's certainly something we can explore.
I don't know if
Yeah,
that's-
just like you've got,
I mean, it is an amenity and.
Well, it is, and it's a tourist attraction, and
And we're not gonna cover it with raising the rate, the fees to play. I mean,
Price anybody out.
right.
but I think it's important, and it benefits the city. So I think we need to look at it as an asset and approach the funding from that standpoint.
I think so too.
Okay. If one of you can work the advance the slides, I'll go ahead and take the last 2.
Sure.
So, don't want to go over all of these in great detail, but just kind of whetting the appetite for you to be thinking about what are your priorities for next fiscal year now, so that we can begin to study those and think about how we can address those. So we just took the key priority areas out of Kerrville 2050 by chapter basically, and then just put a few items here that we're already working on. With the neighborhood character in the community, obviously we want to continue the neighborhood enhancement team, our initiatives there. We're just now launching our first one this spring. We'll do another one in the fall with the idea that we do 2 each year. Not sure we're going to be able to get to another area development plan as quickly as we'd hoped to this year because of just resources and time, but that's still kind of a goal to do 1 a year, looking at a different part of the city. Downtown revitalization, you can see all the projects listed here, and probably more. Main Street's also working very hard at trying to develop their priorities for downtown. In addition to that, we also have the tax increment reinvestment zone, which has had its first year of capture, or will have at the end of this year. You'll all be making appointments soon, probably the next meeting, council meeting in March. And then I've discussed with some of you about the idea about having a work session. So we're working on trying to get a work session around that to talk about where we're going with that whole initiative. Economic development, obviously working with KEDC, and it's in flux right now with regard to its break with the chamber and what that looks like going forward, but I'd like to see what we're doing here. It's very positive. Retail recruitment, we're still working on that, more of the regional perspective, looking at what we don't have, where our gaps are, where the leakage is. We talked about a job demand study when the workforce commissioner was here to look at where are our job demands so that we can begin to develop pipelines and curriculum around fulfilling those or filling those jobs. So we're working on that. And then public facilities, still public safety focused, still looking at the needs for a new public safety building that's ongoing. And then obviously development services improvements, and we could add a number of other areas here as well. Golf, we just talked about golf. And then the next slide, and then we'll just kind of open it up to questions and comments, is housing. We've got multiple projects underway that the city's involved with in some ways, including the Loop 534 property, which we're still evaluating those proposals. In transportation, you heard tonight about streets and drainage, but then also our partnerships with it, whether it's TxDOT or CurConnect or others in terms of trying to improve transportation. Parks and open space and river corridor, extension of the river trail, wrapping that up this year. We talked about the golf course, and then the sports complex. We're really seeing a lot of great activity out there, and it's coming together in terms of all of our relationships out there and better utilization of that.
Can I ask a question about that while you're
Sure.
on that? Where do we stand with the Little League and the Little League contract?
Little League has still got the ball in their court. In the meantime, we've told them, go ahead and play, and we're open to, your use of it for both games and for practice. But we haven't inked a contract yet. They're still, we're waiting for their response to our latest version.
Okay, so I guess that's what I mean. So we've negotiated, balls in their court.
Yes.
We're waiting for them to either accept it or counter it or.
We had general acceptance of terms, and then we went to a contract, and now we're waiting for the contract to be executed, basically.
Okay, so we think this is gonna go forward and we're gonna.
We hope. But in the meantime, we've told them, we're not gonna prevent you from playing out there. So, we know you've scheduled games and practices, so please move forward.
Okay.
Yeah. And then also you heard tonight about Knapp area, Interceptor, that whole pinch point that we have in our system is our next priority in terms of utilities. So other than all that, for 2021, if there's some other things that we've missed in terms of priorities and focus areas, let us know. Doesn't have to be now, could even be, over the next few months as you think about it.
Lots of good stuff.
Lots of good stuff. Need to get this-
Anything else, Council, that you would like to throw out there?
Just a break before the next session.
That's right. So, thank you all, staff. Good job.
Thank you very
This is
much.
good stuff for us to think about. So this is great.
Thank you.
So we will close this meeting at 5:46, and we'll see everybody back here in a couple of minutes.